Hi, I'm Dr. Dave Wolfthal of the Lakeville Animal Hospital in Lakeville, Massachusetts. We're here at one of the herring runs run by the Lakeville Middleborough Fishery Commission. There are two of them that I know of in the Middleborough area. Herring, of course, being a very important food source to the early colonists. And we're here just because it's a gorgeous day, end of September. Almost 80 degrees, which is unusual for this time of year in this part of the country. Rather do this outside than inside. We're going to talk a little bit about vaccinations today. Everybody's got their own questions on what vaccines should my pet get, why are they important, what do they protect against. So we'll start a little bit on vaccines for dogs. When you get a dog, a puppy, one of the first things you're going to do is take the dog to the doctor for their annual or their first checkup, make sure the pet is healthy. And the doctor is going to explain to you which vaccines does your dog need and how often should they be given. Very similar to when you have a baby, they'll get a series of vaccinations. So let's start with that first visit. One of the first vaccines that your pet will get is for distemper. Now, distemper in dogs is a very serious respiratory virus. It causes a severe viral pneumonia. It's transmitted by droplets, aerosol, coughing, hacking, wheezing, sneezing, and the fatality rate is unbelievable. It's almost always a fatal disease. The distemper virus is very similar to the human measles virus. And in fact, 30 or so years ago, when we had very young dogs, we would very often give them what was called the distemper measles vaccine. The idea being that if they had any protection from their mother, if you gave them a distemper vaccination, it wouldn't take, but the measles portion would take. And if they didn't have protection from their mother, we'll talk about that in a second, the distemper portion would take. That's no longer done. The vaccines have gotten much more effective, and distemper measles vaccine has gone the way of the dinosaur. It's not recommended any longer. So anyway, you get your first puppy. Let's assume that this puppy came from a mother that was protected against distemper. And the puppy nurses. Well, in that milk that the puppy gets, the puppy's going to get some antibodies from the mother, and this will protect the pup for varying periods of time. Wonderful, except we don't know when that maternal protection wears off. So the recommendation against distemper, this really nasty bacterial pneumonia type virus, is to give the puppy a series of vaccines. You start as early as 6 weeks of age, and then you give them anywhere from every 2 to 4 weeks until the dog is 16 weeks old. As a rule, we usually start at 8 weeks and do 8 weeks, 12 weeks, 16 weeks. The first booster is given 1 year later. After that, boosters are usually given every 3 years. The vaccine is surprisingly effective. Very rarely do we see distemper now in dogs that have been protected. Primarily, this is a disease of the unvaccinated, very young dog. And again, it's a pneumonia, coughing, hacking, wheezing, sneezing, runny eyes, runny nose, very often fatal in and of itself. If they survive, and I mean that very seriously, if they survive the pneumonia portion, the virus does not go away. It hides in the body. In this case, it's a lot like the chickenpox virus. And the virus can then break out months, weeks, or even years later, except this time it breaks out as a nervous system disorder. So you end up with a dog who will have seizures. And unfortunately, there's absolutely no treatment for the seizure issues that we get with this type of virus. You can try and control them. Very often you're not successful. So that's distemper. Along with distemper, we also vaccinate against parvovirus, which a lot of people have heard a lot about recently, and hepatitis, and parainfluenza virus. These are all put together in one vaccine. So even though we call it distemper, you're actually getting protection against several other diseases. Parvovirus, intestinal very severe vomiting and diarrhea. Again, it has a relatively high fatality rate. Again, it's the very young, unvaccinated dogs who are most at risk. There has been an outbreak of parvovirus recently north of Boston. Again, mostly shelter-type dogs, young puppies, unvaccinated dogs. Severe, severe, severe vomiting and diarrhea. The treatment is actually pretty simple, but intensive. I have diarrhea, you get medication to stop the diarrhea. You're throwing up, you get medication to stop the nausea. Antibiotics to prevent a secondary bacterial infection. Most important, fluid therapy, IV fluids. There's so much fluid coming out of these dogs, they actually die of dehydration and secondary problems. Since it's a virus, there's very little that you can give. There is no such thing as an antiviral that you can give them that will help to kill the virus in its tracks. One exception to that, there are very noticeable reports, this has now been documented, the medication Tamiflu, which is used for human flu victims, has been known to help these dogs, but you really have to get it into them pretty early in the disease. So God forbid you get a dog who has parvovirus, it is treatable with a lot of work. Sometimes these dogs need to be hospitalized, they do need to be isolated. This is a virus that is very, very hardy. So if the dog sheds virus in the environment, this virus can live for long periods of time in the environment. Grass, heat, cold, ice does not kill this virus. Bleach does, but unfortunately it does not rain bleach in this world. So killing it in the hospital environment or in the home environment with a bleach solution, hi kid, works very well. Outdoors though, boy, you have to be careful because you can pick this up anywhere. The distemper virus, thank God, does not last very long out of the body. It really needs moisture to survive. The hepatitis virus, that's another fun virus we don't see very much of because almost everybody is vaccinated. Very similar in disease process to the hepatitis in people, causes liver disease, causes vomiting, diarrhea, issues along the lines of liver disease. It can actually make you yellow. This also has a pretty high fatality rate, but as long as we are vaccinated, the risks of getting this are pretty low. Parainfluenza, this is part of a respiratory complex, commonly called kennel cough. Kennel cough is not one single entity. It's made up of the parainfluenza virus. It's made up of a bacteria called Bordetella. Believe it or not, distemper virus is also considered part of this respiratory complex. There are some other organisms called mycoplasma that are part of this. The big problem with the kennel cough issue is we can't vaccinate against everything. We can only vaccinate against parts of it. Parainfluenza being one part, Bordetella being the other big part. In fact, Bordetella is the biggest part. Bordetella vaccine is usually given, well, anytime after the first 2 to 4 weeks of life. It's usually one dose and it's repeated annually. The parainfluenza virus is just like the distemper and just like the hepatitis virus, is given as part of the distemper hepatitis complex, 3 doses, 8, 12, 16 weeks, booster a year later, and then a booster every 3 years. Kennel cough is not going to kill your dog. Parainfluenza virus is not going to kill your dog. But both of them can make the dog very, very, very uncomfortable. If you've ever had a cold and your cough lingers and lingers and lingers, you sound like a goose honking. Oh, that's what this does. And again, it's hard to deal with. Basically, you have to make the patient more comfortable. Hello, Troika. Hi, it's good to see you too. So those are the really big viral and bacterial vaccines that are done pretty much across the country. The next one, everybody knows about this, is rabies. Rabies is a horrible disease. We have, as far as I know, one person in the country who has contracted the rabies virus, become ill, that's an important point, become ill and actually survived it. She was also put into a medically induced coma for quite a while in order to treat her properly. Rabies is a virus that is transmitted by the saliva or the scratch of an infected animal. The virus enters the body through a wound, a bite or a scratch. It travels to the local nerves. From the nerves, it goes to the spinal cord to the brain to the salivary glands. Now it can be transmitted to the next animal or person or whoever is being exposed. The time span for this to occur from entry into the body until it gets into the brain in a dog or a cat is considered to be about 6 months. So that means if you have an unvaccinated animal and they've got a bite wound that you don't know how they got, possibly from a rabid animal, it can take up to 6 months before that patient is considered to either develop the disease or to be sure that the disease is not going to make its appearance. Because it's a disease of the nervous system, the signs that you see, and hopefully you will never have to deal with this, are signs of abnormal behavior, paralysis, can't swallow, which is where these animals will drool, have tremendous ropes of saliva coming out of their mouth because they cannot swallow. If you were a child of the 50s and 60s and you saw all these early morning Saturday cartoons where they'd put shaving cream around the cartoon character's mouth and said rabid dog or rabid cat, that's where that comes from. These animals will sometimes bite at things that are not there. They call that fly catching or fly snapping. They will also act very bizarrely because their brain is being affected, and they will bite and attack things that normally they would not even think to bite and attack. And that's why this disease is so severe. Once the signs occur, we cannot stop it. It is uniformly fatal. So the only way to prevent rabies in people is to prevent them from being exposed to it, which means vaccinating the animals that people come in contact with. There are licensed vaccines for dogs, cats, even ferrets are required to get vaccinated for rabies. First rabies vaccination is done after age 3 months. Booster is done in a year, and then it depends on where you live. Here in Massachusetts, if done at the appropriate time, a rabies vaccine can last for up to 3 years. If it's not done at the appropriate time, it's a 1-year vaccine. So very important, of all the vaccines, that is the only one that is required by law. Must vaccinate dogs and cats for rabies, no exceptions. Another vaccine that's very important, but it really depends on where you live, is Lyme disease. Lyme disease is transmitted by ticks. It causes severe joint pain, arthritis-like symptoms. In people, it has a whole range of other things that it can cause. In dogs, we know that it can also cause kidney issues, actually very severe kidney issues. It seems to sometimes cause neurologic signs as well, so nervous system signs. In dogs, the way we diagnose this is on a standard screening test. Very often we will come up with a diagnosis that the dog has been exposed and the dog has no signs of Lyme disease whatsoever. We've covered large parts of Lyme disease in some of our other broadcasts. In this case, we're just going to talk about the vaccination issues. The way you vaccinate against Lyme disease, it's a 2-shot series. The first dose, depending on who you read, I find this kind of interesting. The manufacturers say after age 9 weeks, and some of the researchers say after age 12 weeks. The difference is the younger the animal, the less developed their immune system is. So you can't always make use of the vaccine, even if it's given to you. So you need to have a competent, a useful, or a working immune system. So I tend to give it a little bit after age 9 weeks. The second one is given 2 to 3 weeks later. If you're outside of that range, you really have to consider starting the series all over again. Again, next is a difference of opinion. The manufacturer says booster yearly. Cornell University has done some research, and they say that if you give an extra booster at age 6 months, or no, said that wrong again. If you give an extra booster 6 months later, you get better protection, and then booster yearly. So for Lyme disease, what we tend to do here is we give our first 2 vaccines 2 to 3 weeks apart, booster 6 months later, and then once a year. The last vaccination we should talk about, leptospirosis. Leptospirosis is a bacteria. It's transmitted in the urine of animals that have this issue. Big problem are rats, but other animals as well. Raccoons, fox, skunk. This is a bacteria that requires moisture to live. So a place like this, where we've got a lot of water nearby, is a great place for dogs and cats to pick up this nasty bacteria. It attacks the liver and the kidneys. Again, vomiting, diarrhea, can make you yellow, literally. You become icteric. And it does have the potential to kill the pet. It also has the potential to infect and kill the human. So very important that if you have a risk factor, your dog or cat goes into lakes, ponds, streams, these are the dogs that should be vaccinated. The vaccine is, again, 2-shot series, given 3 to 4 weeks apart. The booster is once a year. So those are the big vaccines that we use for dogs. If you have any issues or questions, please call the Lakeville Animal Hospital, 508-947-1309. We'll be more than happy to help in any way that we can. See you next time.